Hello friends, this video on reproductive health part 7 is brought to you by examfear.com. No more fear from exam. The next type of contraception is the IUDs. Now what are IUDs? These are intrauterine devices. So intra means within, uterine means uterus. So these are devices which are inserted inside the uterus. That is why they are called intrauterine devices. Now let us see what are they. These devices are inserted in uterus of female reproductive tract. So this is how the uterus look like, right? So this is the uterus and this is the device. So this entire device, you see a T-shaped device. So this is the IUD. And this is how it is inserted. Actually, it has to be inserted in the right way as is shown in this figure. So obviously this cannot be self-inserted. You actually need somebody who is expert in this, whether it is a doctor or a nurse, to get this inserted. So you need expertise for insertion. There are two types of IUDs which are available. One is copper IUDs and the other one is hormonal IUDs. So these are the two types of IUDs. Now the question is how IUDs work. What do they do that prevents pregnancy or that actually acts as a contraception? Okay, let us quickly have a look at that. So first let us talk about the copper IUDs. Now as the name suggests, copper. So why is it called copper IUD? Because they release small amount of copper in the uterus. Now this is present, this is actually set inside the uterus. Now this device will release small amount of copper, and what will this copper do? This will immobilize the sperm. So whenever the sperm enters, the sperm will be released from the penis into the vagina. Then it will enter through the cervix inside the uterus, right? Now, as soon as it enters the uterus, there will be copper which has been released inside the uterus. Now, these copper will actually react with the sperm and it will tend to immobilize the sperm. So, if the mobility of the sperm is gone, the sperm will not be able to move further. Now, if the sperm is not able to move further, it will not be able to reach the fallopian tube. And if it cannot reach the fallopian tube, there will be no fusion between the sperm and the ovum. So that is one thing that is done, and as a result the fertilization is prevented. So such kind of IUDs are called copper IUDs. The second type of IUDs are the hormonal IUDs. Now these IUDs, they secrete a hormone. And what is that hormone called? That hormone is progestin. And this hormone is very similar to the hormone progesterone, which is naturally secreted inside our body from the ovaries. So this also functions similar to progestin. So what does it do? It makes the cervical mucus thick and sticky. Now cervix is here. So this is the uterus. And where is the cervix? The cervix is somewhere here, the terminal portion of the uterus. Now near this cervix there is some mucus which gets secreted. That is a slimy fluid like thing which gets secreted. Now due to the secretion of this hormone progestin, now if progestin gets secreted, it tends to make this mucus thicker. Now if the mucus is very thick and sticky, what will it do? It will block the entry of sperms. So the sperms will not be able to enter properly. So let us suppose the sperms will be entering from here. They will try to enter from here. But if the mucus is very thick and sticky, it is kind of roadblock for these sperms. So these sperms will not be able to enter inside. So that is one thing that it does. The second thing that it does is it slows down the growth of endometrial lining. So in the uterus you have the endometrial lining, right? So this lining keeps on increasing after menstruation is over, that is the follicular growth. During that the lining keep on increasing. And again later what happens? The lining shades in the form of menstrual flow. So now the formation of this lining is extremely important because this is the place where the baby is going to sit. So the lining is actually the place where the implantation of the embryo takes place. Now if the lining is not happening properly, in that case what will happen? The implantation will not be possible. So when the implantation becomes difficult again, even if fertilization take place, the implantation is not possible because the endometrial lining is not there. So the female cannot be pregnant. So therefore hormonal IUDs and copper IUDs, they release things which actually either immobilize the sperm or they block the entry of sperm or they make implantation difficult, and that ways they work. Now, some of the advantages and disadvantages of IUDs are: advantages is they are ideal to delay pregnancy because they do their job the best possible way. They are relatively inexpensive, not very expensive, so almost everybody can afford it. Side effects, we would not say that there are no side effects, but the side effects are less. Now, whenever you make any object interact with your body, there has to be some or the other side effect, right? Now, except for the natural methods where it is all upon your willpower. So in that case, there will be no side effects because your body is not interacting with any other object. But in this case, your body is interacting with these devices like whether you talk about the copper IUDs or the hormonal IUDs, they are nothing but external devices. So you are putting some external object inside your body. So there might be some side effects, but comparatively they are not very serious side effects. Some of the disadvantages are no protection against STDs, like how if you use if you talk about the barrier method, for example, if you talk about condoms, they act as contraceptives as well as they provide protection against sexually transmitted diseases. But in case of IUDs, they just act as contraceptive. It doesn't mean that if you have IUD inserted inside your uterus, you are safe from STDs, nothing like that. The second thing is pregnancy with IUD can be risky. Now, this is very important. Now, let us suppose if the IUD gets expelled without your notice. I mean, let us suppose the way it has been fit by a doctor, let us suppose by somehow it got displaced, right? And you did not notice that. So now as soon as it got displaced, that means it is not doing its job properly. So in that case, your chances of getting pregnant will increase. Now, if by any chance you became pregnant and the IUD is still there inside your body, which has got expelled without your notice, in that case the risk of miscarriage increases, and therefore the IUD needs to be taken out as soon as possible. And also, since it is an external object and now you have a small life growing inside your body, so the presence of that external object can cause serious infection inside your body. So these are some of the things, but however this is not very major drawback because the IUDs do not get expelled out so often. But yeah, sometimes if it does, and if pregnancy comes along with that, that might be risky. So pregnancy with IUD can be risky. Now, when I was talking about the advantages, there are a few more points that can be noted that women with IUD, it is absolutely safe for them to breastfeed their babies. So like even after they have, suppose if they gave birth to a baby and if immediately she gets an IUD inserted inside her uterus, it is absolutely fine for her to manage with things, and also she can breastfeed the baby easily. The presence of IUD also is not felt by any of the partners during their intercourse, because if the presence is felt, in that case the pleasure of having the sexual intercourse is sometimes interrupted, but that is not the case with IUD. Thank you. Please visit www.examfear.com to watch more videos, attempt free online test, get free study material, find tutors and mentors. Thank you once again.